actually the money spent on Arogyashri, it can be utilized in some other way, like if they want some specialized doctor, the government can provide treatment facilities in a government place, and a couple of doctors or 4 or 5 doctors in that particular city can come there and offer their services for some PPP model.
Absolutely.
And
you're
the
right.
cost from Arogyashri can come down, and at the same time the patients will be able to receive best of the treatments from best of the hands.
You're absolutely right, Natesh. Arogyashri actually is a good model up to a point. At least now I'm very happy that we focused attention on healthcare. The reason why Andhra Pradesh people and we can be proud is that we started this process. Dr. Rajasekhar Reddy, he must be giving credit for that, recognizing the importance of healthcare politically for the first time in India. Therefore, a robust model has come about. But if you think it has universal application, we are wrong. But judiciously used the way you're mentioning, improve the public hospitals at tertiary level and limit secondary care interventions to a certain relatively moderate cost but universal application, and increasingly go towards small nursing homes. See, Arogyashri initially worked well because the new private hospitals, they all embraced it. Now if you notice, my understanding is, because you are practicing, you would know better, most of the private tertiary hospitals are not interested in Arogyashri model because it's not cost effective for them.
Yes.
Because a very high quality tertiary hospital is very, very costly. They can't afford these prices. Whereas 30-40 bedded private nursing homes, small nursing homes, where typically wife and husband or 2 doctors, they live in the same place, available 24 hours, they bring down the cost, ensure quality, they have patient interaction. There the costs are perfectly okay. And access also improves because they're all locally available. You don't always have to go to Chennai or Hyderabad or Bengaluru or Mumbai. So judiciously we must understand our conditions, where the best advantage is there in a model. So Arogyashri, I think, is a very good model, but with the application limited to secondary care in an intelligent manner. Universal care, secondary care, and small nursing homes being the mainstay. Otherwise, Arogyashri also eventually will die. Many, many hospitals that embraced Arogyashri are no longer in Arogyashri. Many people are forgetting that.
Sir, how do you decide in the proposed model which cases to be treated as primary, secondary and tertiary?
Primary is the first point of contact.
Secondary
That's
and
not a
tertiary.
problem. Secondary and tertiary. See, I mentioned to you the 4 sectors where 50% money is spent.
Yes.
Broadly, we all know which require highly specialized management. Suppose something requires a ventilator. By definition, it's a tertiary care problem. ECMO or ventilator. Any heart surgery, any neurosurgical problem. Orthopedic surgery beyond ordinary fractures. Ordinary fractures are secondary care problem. But if you have multiple fractures, trauma care, etc., obviously you can't handle it as secondary care. It's a very sophisticated intervention that is required. Spinal surgery, for instance. So I think it's more by exclusion. You identify the 10 or so areas which require tertiary care attention. Everything else is, as a rule, general secondary care part. I would look at it that way. The high cost, low impact, very sophisticated interventions we identify. Tamil Nadu has identified. Actually, you can go into the list. I have all the lists there. You can go into Andhra Pradesh. You can to see other states. You already have a good idea. They are taking away the bulk of the money, but with fewer patients. Whereas secondary care insurance model must actually deal with the bulk of the problems for all the patients and excluding tertiary care and provide for them separately. Otherwise, this is going to take away all the money without improving the healthcare outcomes.
Hi, this is Taman.
Hi, this is Shraddha Das.
Hi, I'm Priyadarshi. Nenu mi Adi.
Hi, I'm Kashish Vora.
Hi, name is Sri Vishnu.
Hi, this is Aditya. Hi, this is Naga and Vesh.
Please subscribe to Social Post.
Please subscribe to Social Post.
Please subscribe Social Post.
Please subscribe to Social Post.